There you go. All right, you guys should see the main screen there. Okay, so today I want to talk to you guys about emergency response for athletes. We're going to touch on a few different things. What I really want you guys to get out of this is a sense that training, additional training for this type of concept or this type of coverage is very important because you'll use it throughout your life. You might not think you will, but you will use emergency response at some point in your life, whether it's in physical therapy or just at home and just doing everyday life, right? And so it really comes in handy. But today I want to go over certain things like the difference between field care and clinic care. I know you guys are like, really? I know that, right? I know you know that to a certain extent, but kind of go deeper into what do you need to look at when you're thinking about doing event coverage or when you're looking at emergency response and things like that. What the benefits of doing emergency care, maybe some training that goes with it. What are some benefits to doing that? And then breaking up some of the components of, primary assessment, secondary assessment, what goes into those, kind of a review. So you'll feel a little bit more comfortable if you have to do that training, but really 45 minutes of this does really nothing for you to feel comfortable. And we'll go over at the end what I would recommend you do if you really seriously want to get more into that emergency response, whether it's emergency medical responder or emergency response for athletes. It's a slight difference. The athletes are just more specific to the athletic event, the athletic venue. All right. And so we're going to touch on that today. I'll go over some objectives in a minute. But first, I'm doing some stuff with the phones, right? So I want you to get on your phone and text to the number 37607. Just type in my name without the R, 955. I'm just doing a little test one here and see if everyone can answer it.
Where's my phone at?
If you just use your cell phone. And it should show you once you click on that, it should say you've joined Gary Schindler's session, right? And once you see that, you can enter your answer. I hear a young voice. How old is young voice?
Oh, that's the 5-year-old.
Awesome.
I thought I was on mute, but I guess I'm not.
That's okay.
I think he just knocked it off. And my 1-year-old did, but.
Okay, so if you pick something other than motivational speaker, or just let me know, because I want to make sure that everyone's being able to, that I'm getting everyone, right? There's a Tommy boy, okay. I know I have my answer, the correct answer, right? But so are we good? Is there anybody that chose anything else that I might not be getting you recorded on this? So everyone picked Tommy Boy or motivational speaker, which are both awesome, right? But I love Tommy Boy. And if you haven't seen a Chippendale Dancer from Saturday Night Live with Patrick Swayze, you're missing out. So after this, you guys can go back and watch Chippendale Dancing with Patrick Swayze on Saturday Night Live. Awesome skit. All right, so a little disclaimer. I am an instructor for Coaching Steps. So I do instruct on emergency readiness for athletes, okay? In no means am I trying to drum up business here, but throughout my instructing and the more research I dig into, and I still do event coverage here in Grand Forks as an athletic trainer, the more I instruct, the more I get into it, the more I learn, the more comfortable you get, and you can just deal with daily life activities and injuries a lot better, right? So there is some benefit to it. The objectives today, because I have quite a few slides, I want to kind of go fast. I want you to be more confident in recognizing the benefits of emergency response for athletes, but also I want you to feel more comfortable. So if something would happen, that you'd feel more comfortable treating that individual or what you're looking at with that individual when it comes to treatment and how to progress and how to triage and how to progress them on, okay? So we're gonna go over some components of it, the primary assessment, secondary assessment, and we're gonna look at some legal scope. And we're gonna go over a couple cases because people do get sued. And sometimes we think it's just a story out there, but We're gonna give some actual events that took place. I'm gonna let you decide if negligence was there or not. And then we'll go and have kind of a little discussion about it, okay? But before we do that, what I'd like to see is, I want you to pretend you were working, I don't care where you're working, outpatient orthopedic hospital, nursing home, but you're in a small rural community. So just ignore the St. Paul written on the pads, okay? You're a small rural community. And if any of you said, hey, we're having a basketball game this Friday night, would you mind covering it? And you're like, yeah, I'm a physical therapist. I'll cover it for you. Okay. So this is, you're sitting on a bench, you're watching this event happen. Okay. I just want you to watch it and just think about to yourself, like, what would I do in this situation? Okay. Okay. So we were going to come back to that video, okay, in a little bit. Okay. So before we progress, though, I want to know if any of you are considering applying for a sports residency. Okay. So can you just put in your answer again? If you put an answer that doesn't show, just go ahead and tell me or chat it to me. Okay. It's easier if you just tell me. That way I don't have to worry about following chat. But I know we're all zoomed out. I know you guys are probably sick of Zoom. Okay. I'm getting kind of tired of it, but we'll do the best we can. Okay. So some say no, some say unsure. Nobody says yes as of this. Okay. Are any of you certified athletic trainers? This works better with a lot of groups. So if you are, just give me a thumbs up too, if that's easier. It doesn't matter to me. Okay, looks like 80% are no and 20% are yes. Okay, so we do have probably one athletic trainer in here. Okay, and so why I ask that is because we look at some of the benefits of doing this training. Some of the benefits are that if you are deciding to go into a sports residency, it used to be that you had to either be a certified EMT, EMR certified, or a certified athletic trainer to apply to a sports residency. And you need one of those three if you want to sit for the sports specialist exam. Okay. Now the rules change a little bit. You don't need to have the EMT, EMR, or ATC to apply to the program if the program allows it. But sometime during that residency, you have to complete your EMR training. Right. So for me, for our sports residency, I require that whoever applies has to have their ERA. There's EMR. We used to be EMR, right? And now we specialize it to ERA, emergency response for athletes. So it's sports specific. All right. And so if you're thinking about going into a sports residency, you're going to need that sooner or later. If you are a sports specialist, you have to do this maintenance of specialty certification called a MOSC. And every 3 years, you have to renew your ERA or EMR certification. All right. So the benefits are you can get that training, can allow you to go into sports residency, and then you can further continue to provide that for your specialization. So you have to maintain it every 3 years to maintain your specialization. The other benefits of this is, again, I work for a private practice out in Wisconsin. I suppose I should have told you that in the beginning. And I'm an athletic trainer. And so I did a lot of event coverage there as well. And so what you're going to see is if you work at certain events, whether PT or ATC, certain states, you can cover events with whatever healthcare license you want, right? So you're going to get these opportunities to cover events more. And you're going to be working in these more rural communities where you're going to have friends and family like, hey, you want to cover this game for me? 99% of the time, right, it's probably going to go smoothly. You might get an occasional finger sprain or lateral ankle sprain, but once in a while, you could get that kid that just banged his head on the court, right? Or the spinal cord injury, or the heat collapse, right? The cardiomyopathies. You can get these other injuries. And what's the benefit of this kind of training is kind of prepares you for that. It kind of gives you some education on how do you treat that, right? How do you do a primary assessment? How do you complete a secondary assessment? For me, I went to athletic training school, so it's 3 years, over 2,500 hours in the training room and on the field. And so you get that communication and you get that embedded in you. Us in PT, we don't get that. And maybe you do it, Mary, maybe you do it, UJ, but we don't get that specialized, your athlete just crashed down and how are you going to go talk to them? We train you how to question a patient that comes in with a referral for rotator cuff tendonitis, right? And so there's a big difference between on the field and in the clinic when it comes to assessment, progression, evaluation, and treatment. Huge. And I know you guys know that, but we're going to go into that a little deeper today. And then life skills, right? You're going to have a child, you're going to have a spouse, you're going to have someone that get injured that's going to need some medical response, right? It's going to happen sooner or later. So the big thing we talk about is that what's the differentiation between field care and clinic care? Okay, and there's 3 big categories. A lot of them's administrative responsibilities, there's contractual obligations, and then obviously there's catastrophic injury, which you're not going to see those really in the clinic, right? Unless someone has a heart attack when you're working out with them. But the chance you've seen a spinal cord injury while they're in the clinic, very low, right? And so there's a lot more catastrophic events that take place on the field. One of the biggest examples I use for this administrative responsibility is you think about a wrestler, right? And so you have a wrestler come into your clinic. In the clinic, he gets a referral for a lateral ankle sprain. He might be on crutches, he might not be. He might be wearing a boot, might not be, right? But you're going to see him for a lateral ankle sprain. When you see that kid on the mat for an injury, there are certain rules, especially with wrestling, that you have to know about, right? So Ryan, did you wrestle at all?
No, I was swimming in water polo.
Okay. And they have rules of their own, right? But wrestling, you have to know rules to these different sports, right? So wrestling, they have an actual time limit for injuries. I don't know if any of you know that. Does anybody know how much time you get for a normal, say, lateral ankle sprain injury on the mat during an event?
Like 30 seconds.
Pretty close, about a minute and a half, right? So you get a minute and a half to decide whether that athlete continues or does not continue. A minute and a half, right? If they get injured again, if you decide after 45 seconds, okay, go back out there, and then he gets hurt again and they have to stop it again, then he's done, right? So it's quick. So you got to know the rules. It's a minute and a half for an injury. It's 5 minutes for blood, and it's 5 minutes for a head or neck. But you have these time frames. So every sport has these rules. So your responsibility, if you're going to be covering events, is to know the event, know the rules, know the equipment. If you never use a spine board or spider straps, please don't let the first time you do that be when some kid can't feel his legs, right? And so you have to be responsible and learn the equipment, the supplies. You have to complete pre-screening. Can you guys give me one example of a pre-screening that you might do on some athletes? What do you think?
Concussion.
Concussion. What are some do you know a pre-screen tool that we use a lot?
The computer-based testing, whatever it's called.
Yep. So that's called impact testing. So you can do an impact test, which is a 20 or 30 minute computerized test. You can do a SCAT-5. So there's different tests you can do. The thing about those tests are that what if someone comes in after a raging party the night before and they're still hungover, and now they take this computerized testing that's looking at their reflexes, right? And so how you standardize that is important as well, because they might be overly tired. Maybe they're studying for finals, right? And they had a final that day, whatever, and they only had 2 hours of sleep. So that's going to affect their response and reflexes. Some other responsibilities that we sometimes don't think of is volunteer versus paid. So if we're paid to be there, we have a duty to act. But if we're a volunteer, that might change as far as insurance coverage, right? And so that's why you might want to look into having your own insurance, liability insurance, as a single provider instead of going through your facility. So even when you're volunteering, you have to check on those things and make sure you're covered. When you're at an event, are you there for the athletes? Are you there for the coaches? Are you also there for the spectators? Who are you there for? So having an understanding of who you're responsible for is important as well. And then there's 2 things, right, that save your career as a therapist or athletic trainer. 2 things, right? Good documentation and good body mechanics. So it's really important that you you have good documentation all the time, especially if you're talking emergency response or emergency medicine, okay? Because sometimes that quick decision, quick last minute decision, you want to make sure that you have that documented, what you did, what the pulse was, at what time you applied this, and have it a tight documentation, right? So that's gonna be a lot different than in the clinic. Some contractual obligations, again, you're gonna be coordinating with EMS a lot, at least you should be, right? You should be developing an emergency action plan at each venue. So if you're covering, it's a lot easier if you're normally the healthcare provider at a facility like a high school, right? If you go there consistently, you get to know people, but you need to really have these EAPs established at each venue. So you should have it at the baseball diamond, you should have it at the gymnasium, the football field, and that emergency action plan is basically how you coordinate with the EMS, what phone numbers you need, the hospital phone number, the fire department phone number, where do you want the ambulance to enter, where do you want them to exit. All these things are in that plan, but you need that beforehand. So that's your contractual obligation. Your medical oversight, you all know that there's things that are part of our practice that our professional practice we're allowed to do, but because of the State Practice Act, we can't do it depending on what state you're in, right? So understanding your protocols for concussion, understanding your protocols in standing orders. Can you administer oxygen? Can you administer EpiPens if they have anaphylactic shock? I mean, can you do these things? Those are things you need to be thinking of ahead of time, okay? And I'm not trying to scare anybody into, man, I'm never covering an event, right? I don't want you to scare you, but I just want you to be introduced to things that we don't normally think about, right? And we think we're just going out there to help a friend at a basketball game, okay? When you really need to be thinking, if you're going to help that friend at a basketball game, you have to be thinking of yourself as well and protect yourself and put yourself in the best position, right? And again, insurance. So get your own personal insurance is also very important when it comes to event coverage. And the biggest area, you know, is catastrophic injuries. You're not going to see a lot of head injuries in the clinic. You're not going to see, hopefully you don't see lightning strikes in your clinic, but there could be a lot of weather related, heat stroke, windshield dropping. You could have lightning is a big one. And so you have these catastrophic events that you have to be planning for as well when you're talking about your emergency action plan. Okay. Some legal issues. Can someone tell me the difference between like professional scope of practice, personal scope of practice, and a practice act? What do you think? What do you think? You can say anything. You won't be wrong. What do you think?
Isn't the Practice Act kind of like what's legally you can do, where your professional scope of practice might be a little higher standard than what your Practice Act is?
Right. And so your professional scope of practice is basically, some examples would be the APTA, right? Your profession states that we can administer oxygen and we can complete dry needling and we can order imaging, right? But when you look at your State Practice Act, what does your State Practice Act say? As far as North Dakota, we can dry needle, but there's a lot of states that you can't dry needle. Well, maybe not a lot. There's a few remaining, but they're probably going to come over to the light side, right? They'll wake up and come over to our side. That you still can't dry needle. So even though our profession says, yep, you can, you got to follow your State Practice Act. So it might be you're not allowed to administer oxygen. You're not allowed to administer an EpiPen. You're not allowed to dry needle, right? So the difference is your professional scope, and then your personal scope of practice is what do you feel comfortable doing? What have you been trained in? So I've been trained in dry needling. I feel very comfortable doing dry needling. I'll dry needle mostly any muscle, and I'll feel comfortable and confident doing that. Have you guys done dry needling before? Probably not. If you're a student, you probably haven't, right? But when you get out of college, some states, you don't even need training. And some states are like, come on in, you can do dry needle. You had the education in college, right? Now, are you just going to go grab a needle and start jamming muscles? Probably not. You're going to want to go get some training, right? So your personal scope of practice matters too, of how confident you feel in your ability to do that. And when you move from that, all right, just because your profession says you can do it, but you've never been trained, you don't know what you're doing, and you hurt someone, you're going to be in trouble, right? And so there's those different scopes of practice and practice act that we need to really be familiar with. Something as simple as consent. You know, when you see someone choking or you see someone needing help, right? The first thing we teach you in our course is you got to gain consent. Before you touch anyone, you have to gain consent from them to treat them, right? If you don't and you touch them, they can actually sue you for battery or assault, right? And so you have to gain that consent. Now, does that mean that when I'm covering a football game in Thompson, North Dakota, that when a kid goes down, do I walk on a field and say, James, my name's Gary Schindler. I'm a certified athletic trainer. Do I have your consent to treat you? No, we don't do that, right? Because we're obligated. We have that relationship. We are there. We're contracted to be there. So we don't need to do this, right? We don't need to have consent there. But if you're outside and you're walking down the street and see someone struggling, you have to get their consent, right? Good Samaritan law works across all parts of this country. The keys with Good Samaritan law is that it has to be an emergency, right? It has to be outside of a hospital and you can't be getting paid, right? If those three things suffice, then the Good Samaritan law works, right? You won't be sued. You won't be liable for doing anything unless you're doing something that you have no business doing, like inserting a tracheotomy, right? Stuff like that you have no training in. But normally we're good there, right? So when it comes really down to negligence, and that's where a lot of people get sued, is negligence. And in order to be negligent, you need to have 4 of these areas, right? You have to have a duty to act, which means you're getting paid or you have some obligation. You need to have a breach of that duty. Either you did something wrong or you started treating, then you left, right? Or you did something that's outside of your standard that you should have never done, right? And then because of that breach of duty, there is it correlated with some injury. And because of that injury, you had short-term and long-term damages. You need 4 parts of that to be negligent, okay? You need duty to act, breach of that duty, causation, and then damage, okay? So we're gonna go through 2 cases really quick here of one, a boxer, and one, a football player, young kid, football player, okay? And I wanna get your opinion on it. So the first case, it was a boxer, okay? He got hit by boxer 2, illegal punch to the back of the head. Immediately, the boxer was hunched over in a corner, grabbing the back of his head. He told the ringside physician he was dizzy, hurting in the back of his head. He told the physician he could continue, and the physician concurred. He waited for boxer 1 to shake it off. Once he shook it off, he continued fighting. Over several minutes, symptoms progressed. He got more dizzy. The referee finally ended the fight. The boxer came back over to his corner, laid down. 25 minutes after that initial complaint, they finally called 911. Okay. Boxer arrived at the hospital. He was in a coma for several months, life-altering results. And yes, he needs constant medical care because of it. So, if you're looking at duty to act, breach of that duty, right, cause and damage, was there negligence here? Go ahead and let me know what you think. If you choose I need coffee, I completely understand. Yes, right? So there's negligence because they actually end up suing this ringside physician for $50 million and they won, right? Because this gentleman had lifelong mental cognitive issues and damage because of that fight. And so it should have been called, right? And not allowed back in. But yeah, there was duty. He breached that duty, let him go back in. He didn't do proper testing. There was some damage or a cause there and it led to lifelong damage, right? So there is some negligence there. Here's a second case. So September 2007, this gentleman by Ryan Doherty sustained his first head injury. Okay, a year later, now he's a junior. He was doing some football drills, blocking drills. He got hit, right? He fell down. He couldn't get up. He says, I'm dizzy, I have a headache. The athletic trainer came over. He was vomiting. Eyes were glassy. 2 weeks after that initial event, he did impact testing, which Logan talked about, right? Impact testing. However, the ATC did not look at the scores, but he ended up being cleared by his personal physician, right? So his personal physicians cleared him to go ahead and start resuming back to play type activities without looking at the impact test. And so for the next 9 days or so, the physician wanted the ATC to monitor him over a 5-day period, put him to exertional activities, see how he handles it. Well, the ATC only saw him for 2 of the days he didn't show up. Okay? So then on the 13th, this big game was coming to town, right? One of the better teams in the conference, and he wanted to play. So he actually was there in the first quarter. He dressed up. He got hit while he was making a tackle, and he was writhing in pain. He collapsed on the way to the sidelines, and then he fell into a coma. That was on October 13th. 2 days later, he died from severe brain hemorrhage because of a second impact syndrome. Okay. The ATC said that she saw him suited up. She had not formally cleared him, but assumed that the coaches knew, and he was still kind of working back into action. Said she talked to him before the game. He was excited. Basically, she said her decision was influenced by the fact that the doctor cleared him, even and thought that he wanted him. He was still symptomatic. Okay, so was there negligence here? Of course, right? Because I mean, they do impact testing. They don't even follow up with the impact testing, right? And so they don't know how he is compared to his baseline. They wanted to put him through an exertional testing for 5 days. He didn't even do all 5 days. The communication between the physician and the ATC, poor, right? And so, yeah, there's negligence there. And this poor kid lost his life. Now, the education council, the Department of Education in that school actually paid out his family $2.8 million. All right, so I don't know how that works. Boxer still alive, mental damage 50 million. Young kid, 16, 17 years old, died 2.8 million, right? So big difference. But either way, they had to pay because of that negligence that occurred at that point. So why do I show you guys these cases? Because they're real, and it's going to be our best interest, mine and yours, to always maintain our training, maintain getting into the literature, maintaining our hands-on application, so we don't accidentally do stuff like this, because it's so easy to do, right? Because these athletes want to get back they want to get back so bad, right? That we sometimes succumb to that. But I bring this up because we have to be really firm, especially with head injuries, on returning them to play. Okay, so very strict on some of those guidelines and protocols. All right. So as you're going through this, you're looking at the legal scope of practice, legal issues. We get into the actual assessment part of it. So when you come up to some situations like this, what is the best way to primarily assess these injuries in complete secondary assessments? You know, what's the best thing to do? How do you do it, right? So when we talk about primary assessment is this person going to live? That's what you're looking for. Are they going to live? This is life-threatening. Let's rule that out. That's your primary assessment. You look at the general impression, the surrounding area, how they're lying, how they're acting. You look at their mental status. You do your ABCs, any extreme bleeding, are they in shock? So your first primary assessment is, are they going to die, right? That's what you do. So part of that is your general impression, and that's when you survey the scene, and you try to make sure you're always looking at the field of play so you can see if you saw the mechanism of injury, how serious the injury is, the condition of the athlete. Was there 1 or 2 athletes involved? Do you think you're going to need higher level of care? Things like that, right? So you're surveying the scene. So I have a video here I want to show you. My guess is you don't see it.
No, we can't.
Yep, so I'm just gonna do you see it now?
Yep.
All right, so you see the bull rider?
Yeah, we just can't hear it.
So go ahead and look at his ankle here. All right. Let's see if I can get back here. Which one am I sharing now? I think I shared the wrong one. Oh, darn it.
General impression.
So you see this big screen of general impression?
Yep.
Perfect. Yes. Yeah. And so with that, I mean, what are some things like if that would happen and you were covering that, which by the way, does Bismarck still have the Professional Bull Riders Association there? Do they still have that event there in Bismarck? No?
I don't know. I'm from Chicago.
So
Yeah,
they
I'm
use,
from Oregon. I don't know.
oh yeah, they usually had that there because I talked to Schulte and those bull riders they're crazy, man. So that's a lot of pain to go through. So say you're covering that event. I mean, what are you looking at when you're going on out there? What are you concerned about? If you open the gate and you go out there, what are you concerned about? Would you want to make sure that that bull is somewhere safe, right, away from you?
Yeah.
Exactly, right. So when you talk about general impression, you're looking at the environment. You're like, that bull better be gone because I don't want to go out there and get trampled, right? And then from there, you're looking at are they moving? Are they not moving? How serious is his injury? Because the most serious injury are those that aren't moving, right? I'd much rather have a kid out there writhing in pain, moving around, than someone just lying there. Okay. So having that general impression of how severe you think that injury is, with 1,000+ pound bull landing on the head, arms, legs, he broke both his legs there, you know there's going to be a lot of trauma. Okay, so understanding the situation, get a general impression, and then moving forward with your primary assessment. So you're going to want to look at their alertness, right? You're going to see if they have verbal response, painful response. If they're unresponsive, you want to focus the athlete on you. You don't want to be getting all nervous and jittery and like, oh my god, talking fast and shouting. You want to have this what I call the NPR voice, where you're calm. You have them look at you. You have them stay focused, and so that's a skill that takes time to develop, especially in a situation like that, or if the kid is crying. Okay, and so you focus the athlete on you all the time, and it's kind of calm them down when you're speaking to them. But you got to check their mental status. On top of that, again, you check the airway breathing just like you've always done with the head tilt, chin left, or a jaw thrust if you think they have cervical injury. Sometimes these trainers will have mirrors with them, so they can, athletic trainers, so they can put it under their mouth and they can see fog up the mirror to make sure they're breathing, okay? But you want to check their airway and their breathing as well, and then also their circulation like you normally would, right? And then you want to make sure that there's no excessive bleeding, depending on what kind of injury you have. So that's your life-threatening. If you see blood spurting, you're thinking artery, right? So the best treatment for bleeding is direct pressure. But if you can't control it, the last resort is using a tourniquet, because you have about 1 to 2 hours with a tourniquet on. That after 1 or 2 hours, you start to have some tissue death. From 4 to 6 hours, you're going to lose a leg. Okay, so normally we go a couple inches above the cut, put on a tourniquet, but when you decide to put a tourniquet on, you're not going to take it off. Because if you take it off, it's going to blow up, right? It's going to be excessive bleeding, worse than before. Okay, then that all could lead to shock. So with this video, I'm going to get your opinion on what you do with this. Okay, this is what happened. Skate comes up, hits him in the neck. You see the blood trail all the way over. All right. So those are some situations that do they happen often? No, thank goodness. Hopefully they don't ever happen, right? But hopefully you get this idea of, are you prepared to treat something like that? So how would you treat that? Well, obviously that'd be direct pressure, man. That'd be 911. You'd get him somewhere quick. And usually those kind of injuries are the best ones to treat because there's really no thinking. You just compress, go, 911, go. The ones that are difficult are the ones that you're debating whether they should go back in the event or not. Those get a little trickier. Okay, but those are some issues that might come up. So I want you to prepare for that because it could lead to shock, and shock could kill you, right? The lack of blood going to your other organs. It could lead to all these other failures of your organs and loss of consciousness. You eventually die. Okay, so the first sign and symptom of shock is going to be mentation. You have cognitive changes with that. Okay. So the wrap up of the primary assessment then is a lot of times when you're doing your primary assessment, you want to make sure that nothing's life-threatening. Okay, this is life or death here with primary assessment. And if there is something there where they're unstable, you want to monitor every 5 minutes. If they're stable, normally we'll go 15 minutes, okay? But it changes how often we actually monitor. Sometimes you won't even get to a secondary assessment, right? But your role might be just to control the situation, help package the athlete and transport, or it might be to move on to that secondary assessment. It all depends, right? But the first one, primary assessment, you're just determining, is this life-threatening? Could they die from this? And then you want to treat it with that, okay? So when we go back to this initial video of this kid, okay, I'm not going to show it again, but when you're going out there, does that kind of give you a little bit more mission of what would you do, right? What do you think? They went out there right away and they kind of held them down. Are you supposed to do that when people are seizing? No, right? So you're not supposed to hold anything down. You're supposed to let them go, right? You hold them down, that can make more things, damage more things, right? So you're supposed to control it by just don't hold the patient down. So they did a couple mistakes there, but I want to keep going here so we have time. I don't want to cut you short. I want you to see this one here. So this is a soccer, obviously. Oh, darn. I wanted to pause, but it's not doing it. So with that, what are you going to do when you're going on field? What are you thinking of? So you see two of these ladies laying down. Which one are you going to go to first? What do you think?
Not moving.
Exactly. So you're going to go to one that you maybe isn't moving as much. If they're both moving the same, you're going to be looking to see which one's bleeding the most. Okay. Head injuries bleed excessively, right? And so it might look a lot worse than it really is. But you have to determine going out there how many people are injured, what happened, are they moving? These athletes, teammates, they'll try to grab them and pull them up, right? They do it all the time. So you got to get out there quick enough so you can tell them to get away. And so all this stuff should be running through your guys' minds as you're thinking about going on that field. Okay. And then once you determine it's not life-threatening, you can go into the secondary assessment. And that's when it comes into your basic normal history taking, palpation, head-to-toe exam that you've done throughout PT school, right? So this is actually a patient of mine I'm currently treating. I'm going to tell you, he came in with, he had an ankle dislocation from this, okay? But I'm going to test you guys, and I want you to see if there's anything else that got injured prior to his ankle dislocation. I'm going to show you a few times, okay? Okay, this is right leg. What do you think? You want to see it again or you got it? You can see his ankle is dislocated right there. Okay. So he came in the clinic. He was like, yeah, I dislocated my ankle and then I tore my quad tendon. And he had this video. And I'm like, I need to see this video. Right. And so I watched video. I'm like, dude, I said, it looks like you tore your quad tendon and then your ankle got twisted and all that weight came directly, it's like 400 pounds, directly down on your leg, drove your ankle into inversion and dislocated your ankle. So he actually had a quad tendon tear plus an ankle dorsiflexion or ankle dislocation on that. He's like, oh, that makes sense. I'm like, yeah, that's what it looks like. It's a cool video, so I have to use it. So I'm sure I'll have it in PT class again at some point. So you see something like that. Okay, some of the components of the secondary assessment, again, your history, your vitals, the normal things you do. Sample questions, very important because when the EMTs show up, they're going to want this information. So it's easy thing to memorize, looking at signs and symptoms, any allergies, medications are on, pertinent medical history, when they ate or drank last, any events leading up to it. It could take away other things that might be going on, like even something as easy as low blood sugar. You might think they have a head injury. You might think that they have heat stroke, right? But they could just be low blood sugar. So getting that information is crucial as well. So we'll use these sample questions. The next one, I can't even call this an acronym because it stands for nothing, right? But they have it out in the literature. So this is a lot of observation that you're going to be doing, right? So you do this in the clinic all the time. So it's no different. But you're doing this head-to-toe exam. So for the bull rider, right, you go out there and you assess, you get him off the field, you do your secondary assessment, you're looking at his cognitive abilities, you're doing a head-to-toe exam to make sure his cervical spine's not broken, right? And then once you get through this head-to-toe exam, you will then focus your evaluation on his broken leg, on his knee, on his hip, whatever area it is. And then you kind of do this overarching and then you narrow it down to the focus area so you don't miss anything. Because a lot of times you can miss things, right? You can miss a head injury when you're looking at, if someone falls, if you're looking at their arm or shoulder, they could have cracked their head. Okay, so we do this overarching head to toe and then you focus it. Okay, and then when you're done with that focus evaluation, you have the decisions to make. Either they return to play, you treat and stabilize, or you transport. Basically 3 options every time. And that's what your assessment has to bring you to, one of those 3 options. So some of these pearls of secondary assessment, again, if you're going to splint someone, check pulses before and after, reassess every 5 to 15 minutes, follow your protocol, especially with concussions, okay, and remember your PPEs. So my advice to you guys is, what do you do next? Man, I'd say get some continuing education. If this is something that you want to do, if you feel like you're going to be in a rural area, if you feel like you want to do some event coverage, get some training for it. Believe me, I mean, PTs that come out of the clinic, they can go straight and do event coverage. It's totally different. You have kids crying, you have coaches breathing down your back, and you have the parents there. And you combine that with the crowd looking at you, it's totally different. So receive the training, and then beyond that, build relationships with ATCs, EMRs, EMTs, and get out there and observe and hang with them and see them work, right? And get that experience that way. And then continue to ask questions, okay? It's going to make you more comfortable, more confident if you're in that situation. But if you do all that and you never practice and never apply what you learned, it's not going to be successful, right? So UND, they practice spine boarding twice a year, right? Hopefully they never use it, but they still practice it. They practice splinting. You always practice in case that one time out of 10 years you need it. That's what you practice it for. Okay, so if you're interested in doing some of this, that's my recommendations to all of you. So that being said, that's kind of emergency readiness for athletes. That's a guy's ankle dislocation on the right. So they actually went down. He was in the basement. He has a gym down in his basement. He hopped up the steps and he's in his living room. EMTs come there. They try to put him in a wheelchair. They turn a wheelchair, hit his foot against the couch. Okay. He ends up getting out of the wheelchair, hopping down his flight of steps, like 14, 15 steps, and then sits in the ambulance. So hopefully we won't do that, right? Hopefully we'll splint it correctly and not have him hop down steps. But I don't know, you guys have any questions about anything regarding emergency response, emergency medicine, anything? Have to have at least 2 questions. That's my rule.
At what point when you're covering an event do you find that you have injuries that are like outside your scope of practice and you just hand them right over to like paramedics?
Again, that's a good question. That's going to be really dependent on you individually. And so some of these EMTs are like seriously still in high school,
Yeah.
okay, in these small communities. And they probably never spine boarded before, right? Other ones have been there for years. And that's why if you know that if you have a relationship with the school and you know those guys and gals and you see them every weekend, you build that relationship and you know. And a lot of times they spine board more than I spine board, right? And they might do it a little differently, but they'd have more experience there. So I have that conversation with them before the game. Before the games, I go talk to whoever's there and be like, okay, this is, if I need you, this is the hand signal for come on the field. If I just put my one hand up and don't do anything, that means just come over to the sideline. I need you over there. So you develop these hand signals, you develop these relationships. And so it's really dependent on you and what your comfort level is. The worst thing at an event to happen is, again, the kid seizing like that, spinal injury, cardiomyopathy, someone actually dying. So understanding, are you having EMTs there that night, knowing that ahead of time, knowing where your AEDs are, going to an event early, talking to the athletic director, talking to the referees, talking to the other coaches, talking to the EMTs, knowing where they're going to be, where you're going to be, where the AEDs are. That's all important. Okay, just because at one time something crazy might happen. Okay, and that's what you're preparing for. And you pray to God it never does, right? But the one time it might happen, right? We train to be prepared for that one time. And it's lots of our practice act. I don't reduce anything. I'll try to reduce the dislocated shoulder one time. Okay? If I don't get it, I splint them, they go. I'll try to reduce patella or a finger, but other than the shoulder, patella, and finger, I don't reduce any dislocations. But other people might not feel comfortable doing that. So it's really up to that individual. Yeah, good question. Any other questions?
How long is the ERA class?
It's a 2-day course now, and it's good for 3 years. And so, yeah, there's some differences now because of COVID. We're doing more online ones of those, which I think are not as good as in person, obviously. You can do a lot more splinting and spine boarding together. So it's not as good. So if you have a chance to go to one and you're not in a hurry, I'd highly suggest you wait and do an on-site one. You'll get a lot more out of it. You'll have be able to splint people and spine board, and you'll get a lot more out of it than if you do it online. That's just my opinion. But yeah, it's a 2-day. It used to be 2.5, 3 days, but they narrowed it down because it's more sports specific. And then it's every 3 years instead of 2. Yep. Any other questions?